Meanwhile, South Korean health authorities are scrambling to figure out the movements of the country's 16th patient who returned from a trip to Thailand about 2 weeks ago. Hyeong-woo reports.
The Korea Centers for Disease Control and Prevention confirmed a 16th coronavirus case in South Korea on Tuesday. The patient is a 42-year-old Korean woman who returned to the country on January 19th from a trip to Thailand. The patient is known to have visited Bangkok and Pattaya during her trip to the Southeast Asian country. Although she showed no symptoms upon her arrival in South Korea, the patient later began to feel fever-like chills on January 25th. On February 4th, she tested positive for the coronavirus at the Chonnam National University Hospital in Gwangju, where she remains in quarantine. Health authorities are trying to figure out how she was exposed to the virus, where she went, and who she has been in contact with.
We're disclosing the movements of the confirmed patients to let the citizens know whether they could have been exposed to the virus, so they can watch their status more closely and quickly take the necessary steps if any symptoms are found.
The Korea Centers for Disease Control and Prevention said the first 15 patients with the virus are all in a stable condition. In fact, one of them, a 55-year-old Korean man, has been treated for pneumonia and could be released as early as this week. The health authorities have run infection tests on 607 people with symptoms. 462 of those tests have come out negative, and those people have been released from quarantine. The Korean government is also closely watching 1,318 people who have been in contact with the confirmed patients. Hyeong-woo, Arirang News.